What is pelvic floor physical therapy and how can it help? Pelvic floor physical therapy is a specialized type of physical therapy that is offered to address bowel, bladder, and sexual dysfunction. It is nice that we get to assess the muscles externally as well as internally, vaginally or rectally. So whenever someone comes to see me, I'm not just looking at those muscles internally, but also on the outside. So I want to see what's happening at the pelvic floor because it is the center of our weight. So what's happening with your posture, what's happening at your feet, what's happening at your pelvis. If your pelvis isn't in proper alignment, then those muscles that run in between the pelvic bones also can't engage and relax the way that they're supposed to. I also like to see what's happening at your neurological system. The pelvic floor is the bottom of our central nervous system. It's a part of our parasympathetic nervous system and our sympathetic nervous system, so our fight, flight, freeze. It's also the tail end of a lot of nerves that come from our thoracic, lumbar, and sacral spine. So if you have anything going on orthopedically up and down the chain, then you may be getting symptoms at your pelvic floor that we can address. Also, if you're not getting enough stability throughout your body throughout when you move, then instead of using your muscles, you may be using your diaphragms. You have 3 different diaphragms, and your pelvic floor is just the bottom one. So we have a diaphragm at our throat, we have a diaphragm underneath our rib cage, and we have our pelvic diaphragm. So if you're not engaging your core properly, then you could be overly working these diaphragms in order for you to find your stability. The pelvic floor is also the bottom part of the canister of air that is our body. So every time we breathe, we accept air into our rib cage, into our lungs, but also into our diaphragm, and then your pelvic floor actually relaxes and your tailbone moves out. Then when we exhale, tailbone moves in, pelvic floor engages, organs move back up, and the air leaves the lungs. So if you're not breathing efficiently, then you may have pelvic floor dysfunction as well. So these are just a few of the things that we look at whenever someone comes to see us for pelvic floor physical therapy. It is wonderful to start peeling off layers of the onion so that way we can find what is causing your symptoms. You are fearfully and wonderfully made.